Okay, if you're new to exercise physiology, you might wonder what we do in an initial assessment. So we want to get to know you in order to create an individualised, appropriate exercise program. So initially we want to know why you've come to see us, what your diagnosis is, what your treatment has been so far, including medication, and how this has affected you. Also things like what's going on in your life, your work demands, life demands, if you're active or sedentary typically, how you're sleeping, what sort of support you've got at home, what your diet's like, that sort of thing. And then we talk about your current exercise levels, so what type of exercise you're doing, the frequency, intensity, duration of that exercise, what you enjoy and what you would like to be able to do with exercise. We talk about your exercise history and your literacy, so how well you understand exercise. And then we talk about your general goals, so what you hope to achieve by coming to see us. And then we do lots of measurable outcomes, so looking at things like your blood pressure, resting heart rate, oxygen saturation, body composition if that's relevant. We take girth measurements if that's relevant, range of movement assessments and flexibility tests if that's relevant. We do strength tests like a sit to stand, a grip strength, might do a modified push-up. We do balance testing and also a fairly detailed cardiovascular assessment where we look at your heart rate response to exercise and increasing load, and then watch your recovery to that exercise and that test. And then we go back and look at those goals again and see if there's anything where you need to improve and add to those goals if necessary. And then we might refer you on to other professionals. For example, we might find that you would benefit from seeing a dietitian or a psychologist or a lymphedema therapist or a pelvic floor physio, for example. And then we discuss a plan, your exercise plan, how we're going to implement that, whether it's at home, in your local facility, coming in to see us regularly or joining a group. And then we'll usually deliver and prescribe your exercises at the following appointment.